call it the system. What does it consist? You already went through this one, that we have the arteries, and from arteries we'll go into slightly smaller ones, the arterioles, and you know that aorta is the major artery in the body, and for veins, vena cava is the major vein in the body. Still just a diagram important for anatomical purposes, illustrating all the major arteries in the body. This was the brachial artery that I said is the most convenient for taking the blood pressure. But equally, on the lower limb, we can use the anterior tibial artery, and you still be able to record the BP using the lower limb. But also, not always brachial gives us the best reading, but equally when maybe you have a smaller cuff BP, you can still be able to use the radial and the ulnar, and you still be able to get good reading. Always remember, if it's an adult, use the adult cuff. If it's a child, use a child or the pediatric cuff. Know the distinction. And also never hold a BP machine just because maybe it's not working well and you try to assist the patient by holding it up. That is fault. You will not get the very precise reading. So the veins, we have talked about them when you say they carry deoxygenated blood, and they are very thin walled. And because of that one, we have what you call the, and the veins have the highest compliance, meaning they are able to stretch and hold a larger volume of blood. And each and every time in your body, a lot of blood is within the vein, and slightly less volume of it is on the arteries. Still just a diagram illustrating of those major veins in the body. And you said vena cava, that's the inferior, and the superiors are the major veins in the body. And this is where you do your cannulation through these veins. So capillaries is a junction between veins and the arteries, and usually one cell thick. Remember from your respiratory system, where we say that the capillary bed at the alveolus, where the gaseous exchange takes place, that is where an example of capillaries. Because of that small thickness of one cell thick, we have the diffusion of oxygen and the nutrients happening at that level. And the blood pressure is lowest at the capillary level, and it's highest on the vein side, on the arterial side, and lower on the venous side or in the veins. And once the blood reaches at the end of the major veins in the body, that will be the right atrium. So the blood pressure is usually on the lowest, about almost zero. And on the right ventricle, just as it enter into aorta, so the pressure is usually around 100 millimeter of mercury. So distinction or compare between the 0 and 100. And because of that pressure differences, we are able to have the circulation of blood. And that simply obeys the principles of the fluid flow, or simply the dynamics of fluids. Okay, so in your screen, you can still be able to just appreciate that diagram where we have an artery on this side, we have a veins on this side, and just show that we have the valves in the veins, and in between we have the lymphatic tissues, and we have the blood cells here, RBCs, body cells, and we have a diffusions blood and the tissue, and we call that one the internal respiration. The flow of blood, as we said initially, is determined by the principles of gaseous flow, and still just another diagram repeating on the same. We say we have the pulmonary circulation together with the rest of what you call the systemic circulation. In terms of the structures of the blood vessels, is just a bit beyond this class, but we know we have the major, they are made of smooth muscles. Anything hollow or anything cylindrical in the body is always made up of smooth muscles. Major bulk of it is what we call the tunica media. We have the internal layer called the tunica intima, and the outer one, the tunica adventitia. And just remember that the veins always have the valves to ensure the blood is moving in the same direction. Just a diagram that makes you appreciate on what you've been talking, the distinction between the arteries and the veins and the capillaries in terms of the thickness. And the thickness is determined by the quantity or the volumes of the smooth muscles. So that's also another diagram showing the veins. Okay, so this is the calf muscles, and the contractions of the muscles ensure that the blood is pumped back into the body, and that ensure the venous return. So in summary, That is the cardiovascular system. It's simply made up of the heart and the tubes that connects around it, which are the blood vessels. And much of the physiology is within the heart and specifically about the cardiac cycle in all the phases that it happens. We start all the way from the contractions of the atria and followed by the contractions of the ventricle. And in between, we have the ejection and the filling, which happen either rapidly or very slowly. The heart rate is determined by the impulses from the SA node and later from the AV node. And the rate at which the impulses are generated determines your normal heart rate. We also mentioned about the cardiac output, which is simply the volume of blood that the heart is pumping each and every minute. And we get that one by measuring or multiplying the volume of the ventricles, and we multiply by the rate at which the heart is beating, and that one gives us what you call the cardiac output. We went ahead and see that the impulses from the heart can be recorded and later interpreted in a paper, and we call that on the ECG. It's made up of 3 waves. That is the P wave, which is the contraction of the atria, the QRS complex, which we said is a composed of the 3 waves joined together, and that one coincide with the contraction of the ventricle. And later we have the T wave, which represent the relaxations of the ventricles. So that is the end of the cardiovascular system. But as I promised you while you are looking at the renal system, that I will join one more thing finally. And I don't have a slide for that one, so you can just listen. It's a small process. So assume that we said that the blood pressure is usually maintained within a certain range. So what happened then when you have an hemorrhage, when you bleed all of a suddenly that your blood volumes goes down? What happened at that point in time? A system will be activated, and that system only has one aim, is to ensure that we restore the blood pressure back. And how does it achieve that one? So this is an interplay between the heart or the cardiovascular system together with the kidney, which is the renal system, and a little bit of course with the coordination of the brain. So the event begins once we have a severe hemorrhage or hypovolemia. We have the receptors in the kidney. Remember what you call the GFR, the glomerular filtration rate, and we have some sensors in the kidney. Once those sensors detect that the blood pressure has gone down, let's say we know the normal blood pressure is about 120 out of 80. And at this point in time, someone has suffered a severe bleeding and the blood pressure has gone down to, let's say, 70 out of 50. Those sensors will be activated in the kidney immediately, which will cause the release of a certain hormone that I mentioned initially, that we have an hormone secreted by the kidney beside the APO, which synthesizes erythrocyte or red blood cells. We add another hormone that we call it renin. Renin is an hormone secreted in blood pressure, and low blood pressure will lead into secretions of some other factors in the kidney. So being an hormone, or we simply also just treat it as an enzyme, because we know all hormones almost act as enzyme. So this renin will act on some protein secreted by the liver that is usually just flowing in your blood. We call it angiotensinogen. Angiotensinogen will be converted into angiotensin. And angiotensin 1 is not active, it's not potent, it doesn't do any function, it's not physiologically active. So it has to be converted into its active form, which is angiotensin 2. And that one is done by some enzymes that is usually produced by the lungs, but it circulates around the body. We call the enzyme angiotensin converting enzyme, or simply ACE. So once we have angiotensin 2, is a very potent vasoconstrictor one, and it will vasoconstrict the blood vessels and increase the resistance, and in that way the blood pressure will increase a little bit, but that one is not sufficient to increase the blood pressure or to rather rescue. It will also cause the kidney to release another hormone that we talked about in our previous class, that we call it aldosterone. Aldosterone was a mineral corticoid that will cause the retention of water. Aldosterone will increase the retention of water in the kidney and ensure the volume increases. So that one will boost the intravascular volume, and at the same time, the pressure will increase. Aldosterone equally increases or activates the thirst center in the brain, in the hypothalamus, and that will give you a desire to drink water. And once you drink water, your internal vascular volume will increase and it will restore your blood pressure. So you can just read about that system. We usually call it renin angiotensin aldosterone system, or simply RAS. So that's RAAS. So thank you. And that will bring us into the end of this section. Unless you have any question, we'll end the session there. So at least now you know that when you go and take your blood pressure, your BP machine, you know what you are recording